one of our core values in our practice is family, and I think that's truly the biggest thing that you kind of run down with anything with culture. With family, you can have hard conversations. With family, you can be, loving and kind and caring and clear with each other. And that's kind of how we treat our team. We try to treat our team as if they're our family. And when you have that aspect in your practice, that you actually care about the people that are in your practice, not just the patients that are coming in, but your staff. They're the ones that make every one of these wheels run. Like, yes, I'm the office manager, but without every one of my staff members, from the doctors down to sterile tech, to even the people who clean our office, like every single one of those people contribute a very vital aspect to our team.
This is Growth in Dentistry, a dental intelligence podcast where we ask the question, what does growth in dentistry look like to you? I'm Katie Polson, a dental hygienist and your host. Welcome to Practice Deep Dive, a series of conversations on our Growth in Dentistry podcast. I'm Katie Polson.
And I'm Adam Smith.
Welcome. We're so excited. A couple times a month, we try to talk to practices, and we really want to hear about those in the trenches, those that roll up their sleeves and get the job done, are the ones that are doing the work. And there's a lot to be said and heard from those practices and those people that are making a difference in their community. And because we have access to over 10,000 practices data, we look at a lot of numbers. And the goal with these episodes is to really take our top performing practices and shine a light on their success and learn from some of the things that have tripped them up in the past. And hopefully that makes something that you can take away. I mean, dentistry, it's lonely. It can be lonely for a lot of people. And we hope this series of episodes helps you feel supported. So before we get started and into it, just a couple of housekeeping items. We want, for those of you that haven't had an opportunity and Facebook is your jam, I don't know, like it might still be your jam. If it is, and you wanted to come join us on our Dental Intelligence podcast community, come join like-minded data nerds, and we can come learn from one another. Also, our current customers, we have an incredible opportunity and a value tool inside of our growth platform. So for those of you that are current customers, it's a space where you can go to get quick questions for your business, great topics and forums. So I'd encourage you to look in your growth platform portal under the question icon, and there's an awesome community that you can become a part of. If you're not a customer and you've been wanting to become a customer, because why wouldn't you? You can have a great opportunity, and there's a giveaway that we're doing for any of our listeners of the show. You can go to get.dentalintel.net/podcast. Again, that's get.dentalintel.net//podcast. You can get $50 when you complete a demo. That link will be in our show notes. Whew, that's it, guys. Okay, now that I've done enough talking, I'm going to introduce to you our wonderful guest here, Zach Shelley. He's office manager at Satellite Dentistry. And we're just going to pick his brain for the next 50 minutes. So it's going to be fun for us. Welcome, Zach.
Thank you for having me.
Yeah. So give us a little bit about yourself first. How did you end up in dentistry, and how long have you been here?
Oh, so I've been with Satellite Family Dentistry for about 2 years. First went into school to be a firefighter and EMT, and here I am in dentistry. Put those together, it makes no sense at all.
Hopefully you haven't had to use your skills in the dental practice.
No, I have not.
Good.
Thankfully, it's a good skill set to have, but haven't had to use them in the office.
That's good.
Yes, I got my feet wet about 13 years ago in dental technology. I was a dental technician for about 11 years, and then came clinical side about 2 years ago, and been loving every bit of it.
That's awesome. Tell us, so you were a lab tech. That's
yes,
super
ma'am.
Interesting.
Yes.
What's your favorite thing to make? Lab tech?
Oh, geez. Well, I specialize in implants. There's really no favorite thing to do, because the mantra with dental labs and dentistry is the lab's always wrong. So you're just praying to God that every case that you do is right, and there's something that they're like, hey, good job on that one, because you did that right, which is few and far between. But
oh my gosh,
doing implant dentures and implant crowns was my specialty.
Oh, we've all delivered a crown and been like, well, sorry, the lab screwed it up. It's so much easier. So
It's an easy scapegoat.
It's so much easier to
It's an easy out, I'll tell you.
blame the lab than, well, we don't know how to take an impression. So yeah, that's so great. Awesome. That's such an interesting roundabout way, and awesome that you've made the switch. It really is helpful to have dental knowledge before you start helping a team. So tell us about Satellite Family Dentistry. Where is it located? What kind of practice is it?
Okay, so we're located in Satellite Beach, Florida, which is just south of Cocoa Beach. That's the biggest landmark people most know of.
Such a
We're
hard life.
Yeah, so hard. Right on the beach. We're about
Jeez.
maybe less than a block from the ocean.
I think we need a field trip.
Yeah, we're gonna do
anytime you guys want to join.
on-premise podcast next time.
Yeah. Do we have the budget for that? I would like to start doing that. Okay. Anyway, by Cocoa Beach.
Yes. So we're a general pedo practice. We have 2 pediatric dentists, 2 general dentists, and a 3rd general dentist joining us next month. We've been in practice since about the late 60s. It's been a family practice. It's been in the family this whole time. So well established in the community and a well-known office.
Yeah, that's so great. We were just talking about Pete. He had to jump in our pre-show to talk to. I asked him how his day went, and he said he was assisting today. It's just such as the life as an office manager. You wear so many hats, and we were talking about being a PEDS assistant. So for those of you that are in PEDS, hats off to you. We appreciate what you do because it's not an easy gig. And I am so glad that we have the ability to pick your brain from a specialty practice office like idea, because I think a lot of times so much gets put on general practices, and like all the information comes from them. And I think the specialties kind of get left in the dust a little bit because there's just not enough information out there. So I'm super grateful for your willingness to join us. So Zach and I got a chance to talk a little bit before, and so we're kind of base our framework, our conversation off of that. But really, the reason why we wanted Satellite on the podcast is they're just, again, we have access to over 10,000 practices data, and they are exceptional in case acceptance and collections percentage. So we're going to highlight that, but we're also going to talk about creating team culture, because for the month for I don't know, it seems like we've been talking about staffing dilemmas. I'm tired of talking about it.
Since 2020, right?
Is everyone tired of talking about staffing dilemmas? But it's such a hot topic because everyone's struggling with it. And so when Zach and I were talking, I was like, what do you do to create a team where people want to stay? And we talked a lot about culture. So let's just start there. Like, what is the culture like at Satellite? Because when we talked before, you had talked a lot about how the culture affects every other aspect of what you guys are really good at. So let's talk about culture and what is it? How does it feel? If I were to come, which I just might get a job at my Cocoa Beach, I might just leave and go work there. What would it feel like?
Well, I have to first ask, are you putting in your notice to your boss next to you?
I was wondering the same thing.
Is he going to have a staffing dilemma at this point?
I'm just keeping my options open. Okay.
Well, one of our core values in our practice is family, and I think that's truly the biggest thing that you kind of run down with anything with culture. With family, you can have hard conversations. With family, you can be, loving and kind and caring and clear with each other. And that's kind of how we treat our team. We try to treat our team as if they're our family. And when you have that aspect in your practice, that you actually care about the people that are in your practice, not just the patients that are coming in, but your staff. They're the ones that make every one of these wheels run. Like, yes, I'm the office manager, but without every one of my staff members, from the doctors down to sterile tech, to even the people who clean our office, like every single one of those people contribute a very vital aspect to our team. And I think when we bring that appreciation and that just bringing them to light that they're part of that and part of our success, like Satellite Family Dentistry is not successful just because of one of us. it's because our team works together and works well together.
Yeah, that's really great. As you were talking, so I worked with my family, like my dad and my brother were my bosses. This is why I have a new boss. It's not related to me. No, but really that it was. I love that you could say that like families can have difficult conversations with each other and not like, like you still love each other at the end of the day. And that's really great that you establish a culture that is like that, because that's not easy to do. Yeah.
So excuse me.
Adam is here, just so you know, guys.
I'm here. I've been told I need to talk closer to the microphone. So here's me being louder.
He's being vulnerable.
Yes.
I don't work on that.
Yeah. I don't want to glance over this too quickly because I feel like this gets a lot of lip service without actual meat to it, right? Like a lot of people will say we treat our employees like family, or we treat our patients like family, right? I've worked with a lot of dental practices who even use that in their marketing, but then internally, when you actually get into it, it may not be the case. So how do you ensure that is the feeling that happens in the practice, and that's the situation that you're fostering, rather than just saying, hey, we treat everyone like family? Like what are some of the things that you would say lead to you having that family feeling in your as a staff, above just saying we treat everyone like family?
So one thing that I try to do, and I know that the owner doctor that is in our practice does, is we are invested in our staff. We don't just come in the morning and do our huddle and just say, all right, let's get to work and go. Like, people bring up, issues or things that's going on at home, or, birthdays. Like, one thing we love is birthdays. We have a birthday wheel that we spin on their birthdays, and we celebrate their birthdays. We celebrate wins. When somebody does a good job, I do my best to come around and say, hey, especially on a new employee, I just saw what you did. That's exactly what we're looking for. And you did a great job with that. Because, when you come in as a new employee, there's a lot of things that you may feel like you're doing wrong, or you're having to be corrected, or you're trying to get up to speed. So when we acknowledge those things, that people are doing well, it's the same thing as when the doctors are building a relationship with a patient. If they tell you, hey, I just got a puppy, and then the next time they come in, hey, how's your dog doing? They're going to remember that. And it's the same thing with their staff. Like, hey, how's your kids doing? How are they doing in school? How are their sports going? And making those connections, not just on dentistry, but actually in their life of what's going on. Another thing I like to do is we just, as a team, we come around when we're done with things. Hey, can I help you with anything? Is there anything that you need to learn that maybe you're not learning right now that we can train on when there's some free time? Just taking that time and being intentional. I think intentionality is one of the biggest things that you can use to build that family culture.
Yeah, that's awesome. And I think it's a fine balance as well, because you can get so busy in a dental practice that the only things that you're focused on are what's next, who's next, what do I have to do, that you've got someone that's waiting on you almost the entire day. And so taking the time to still build those relationships seems like it won't fit into the day-to-day, but when you force it to, that's like you said, when you're fostering that family relationship, that family feeling with your staff. So
and you might just be, oh, sorry, go ahead. No, you go.
No, you're okay. I was just saying, being available to, not being too busy to hear a concern or hear an issue. We might not be able to get to it, but I'm always happy to hear that suggestion or hear that concern. Whether we use it or not, our staff's voices need to be heard, because otherwise they feel like, we're just a number. Being there and being able to be heard is key.
That's good. I mean, so people will give you a suggestion a time or two, and if you don't act like you listen or care, they'll stop. Like,
absolutely.
Like people won't continue to give you that feedback, and sometimes it's garbage, and sometimes it's actual like helpful information that would be like that you want to know. So you said something that caught my attention too, was that you were intentional about giving that feedback. You might just be naturally good at it, and if that's the case, then so be it. But is there a way that you like remind yourself to give feedback like that? Because it's so easy to just pick out the negative all the time.
Oh, absolutely.
As opposed to just finding the positive and then sneaking in some negative. So
Absolutely. So the biggest thing is, it's like you said, it's so easy to find the negative right away. I'm like, hey, you charted this wrong, or this is not in treatment, or you didn't complete this appointment with the correct procedures. So if I see things that are doing right, like there was a specific example the other day of a new staff member, and she did something like perfectly and well and did it efficiently. And I just stopped what I was doing right then and there, because otherwise I'm going to forget.
Mm,
Got up, walked over and just said, hey, great job. Because it takes me, what, 10 seconds of my day to come over and make sure. And it's right after it was done. And they're like, wow, they're actually noticing what I'm doing. I'm hoping that goes far
yeah.
with our staff members. And we do get busy at times. There's some times where I can't, but at staff meetings, when we bring our staff together, I'll pull reviews and we'll go over those reviews and say, hey guys, like this is a product of your hard work, so that they can see the positive results coming out of what they're doing.
That's great. So I heard a couple things there. I heard that you highlight highlight them in this reviews that you get in your staff meetings.
Mhm.
And then also you just do positive reinforcement, like right when it happens. That's really great. Those are two really great. So before, when in our pre-interview as well, we were talking about your morning huddle routine. And I guess let's
Mhm.
talk about those two meetings. Cause I know that most people, not most people, I should not say most people, most effective practices have a morning huddle and they do staff meetings. So talk to me
Yes.
about those two meetings and how they might differ from another practice.
Yeah. Well, the one thing that changed big for us is when we started using dental intel. Dental intel was huge in giving us the ability to just have a snapshot every day of what we need to be looking
Mm.
at. So we really use your guys' platform of um, what we need to go over and what's efficient in a huddle. Because I know a lot of offices, and we were guilty of it at time in our old ways, is we'd go over a schedule. I have a full schedule, no openings. That's all I got. But that tells us no information. It's just saying I can look at the screen and say, yeah, I see that you have a full schedule. But now we have our staff coming in, and it's we're going over if they have unscheduled family members. We're going over balances. We're going over what openings we have, what treatment needs to be done after the appointments today. And it's generating these conversations with the hygienists, the assistants, the doctors all together. And we're in one room like, hey, I just noticed this patient hasn't had their comp exam after they're limited because they came in, they're establishing. We need to get that done today. There's also some pending treatment. I see you have an opening. Let's see if we can get that same day treatment done today if they're willing to. And what that opens up is so much more opportunity for the patient, because we have the ability to see them to get their treatment done and be efficient and effective with that. So our morning huddle meeting is really on our day-to-day of what our days are looking like, what our patients are coming in, detailing family members and all the other things that we had talked about. Now with the staff meeting, we usually do those quarterly, and sometimes we do them more frequently if we're training on something new. And those are going over more of the housekeeping things of our office, maybe changes that we're making, maybe how we're doing referrals was one of the things that we're changing. And then also the perfect patient handoff, that book that just came out. We're actually doing some training on that, on how we can be more efficient with that. So that's what we kind of put
That
into
makes me so
our
happy.
staff meeting.
I wrote that.
That's
That
Katie's
makes me
Did you?
so
Okay,
happy.
awesome. That is wonderful. Yes. So
Guys,
that
this is
drove a whole new
genuine.
training and a whole new meeting
Oh,
for us, on how to do that. Handoffs are crucial and essential, and I think we do a good job. But there are so many things that were highlighted in that are just wonderful and going to allow us to serve our patients even better. So
I
thank
feel
you
like
for
I
that.
want to give
That's
you
wonderful.
a hug through the screen.
There we go.
But let's back up a little bit before to
Yes.
morning huddles. You had said, like, what did it look like before you start? And I mean, this isn't supposed to be an advertisement for Dental Intel. We are Dental Intel. We want to talk about it, but like, what did it look
Absolutely.
like before you started using Dental Intel's morning huddle? Like, what were the pain points, I guess, that like having an automated solved, if that makes sense?
I think the pain points came after the fact of just realizing how much treatment was just not so much going missed, but just not right in front of your face, not
Gotcha.
triggering you to look at those things, and thinking like, wow, we hadn't been doing this forever. And it's so easy. It's one of those things that gave you a tool to look at your schedule and say, okay, we have mom in here, but dad hasn't been in 12 months. Why hasn't dad been in? So mom's in, hey, dad needs to get scheduled. It's a quick, easy conversation. And then now dad is scheduled and reestablished, and now we're working on his oral health care.
And
it's very simple things.
That's not like intentional. I mean, I did as a hygienist, I did the same thing. It's not don't intentionally, like, we don't intentionally try to forget to offer or talk about a case acceptance or like treatments. It's just gets lost in like the daily. I love that you bring that up in your morning huddle, especially with kids. Getting them to be able to do same day treatment is huge, I bet, for the kids and the parents. Yeah.
Mm-hmm.
I think
absolutely.
One thing that you've mentioned just a couple times is it highlights, having an effective morning huddle highlights the opportunity that's there already. When a lot of practice owners and office managers, they're wishing that opportunity was there, but not realizing that it might be there already, right? But they're just, you can't remember all of that stuff. You can't remember so-and-so had a crown planned 2 appointments ago and they still haven't scheduled it. Or like you said, family member that's not scheduled. So it just brings to the forefront, you could affect each day by several hundred to thousands of dollars by making sure that you have the right information in front of you and the right plan to act on that information.
Yeah,
exactly. And it opens the door too of, say you have a patient in at 1 that's in for a crown and a buildup, and they have another crown in treatment. You obviously don't have time to do that today, but then the patient right behind him cancels. Well, great. We need to get this other crown done. And then we can have that conversation where you're not losing out because that patient canceled. You're just extending that appointment time because you've already gone over that, that treatment's already needed to be done, that we can be more efficient and go ahead and take care of all that treatment today because it's already on our mind. It's on our schedule. It's on what we discussed in the morning. So it's not just something new and just kind of popping out of nowhere. It's, hey, doc, our next patient canceled. Yeah, I know you're prepping number 13, but he knows he needs to get 14 done today. Let's just go ahead and get both done. He's ready to do it. It's quick, easy, simple conversations that can make us a lot more productive, a lot more efficient, and allow us to be happier too. The patient's happier, we're happier. They're done in one appointment instead of coming back and having that all over again, getting them seated on the same day and prepped on the same day. It's best for them.
Yeah, that's really great.
That's awesome.
With your staff meetings, you said you'd do some training. Is that like so once a quarter? How, I guess I think a lot of people have troubles with staff meetings because they can kind of become like redundant or not feel like they are like important. Like if you come to enough of them and nothing gets resolved, like how do you make it so that things get resolved and like they seem worth coming to? Just like, because I've been to plenty of them where I'm like, why are we doing this again?
Yeah. We joked. One of the hygienists showed me a coffee mug. It said, I just survived another staff meeting that should have just been an email.
Oh my gosh.
And,
Seriously.
that can be true, especially with the housekeeping things. And, just going over a lot of the same things and what we kind of find yourself in, and it's a healthy thing because, repetition, creates a vision of seeing what's being missed, the same, but also what things are being done right. So, things that are being done right don't need to be gone over again because we've got it down. So I think it's important to have those staff meetings. It is tough, like you said, to be redundant and, just another staff meeting, but we need to attack the problem and not each other. And I've said that in meetings before, like, let's figure out how we can solve the problems. And if we're focused on, okay, this is the issue at hand, how do we fix it and have a solution for it? Then we can be productive with our meetings. The meeting we just had on the handoff and reading that book with the owner, we kind of prefaced where we're trying to go in the future and said, we're just going to kind of touch on these things and we're going to have a full training next month. So I'm going to have a whole plan together. So it was basically just to kind of get everybody's brains, turning and wondering, what can I be doing with my handoffs and how can I be more efficient with it? And then implementation of that actual system will come after the fact. Now, this next meeting will be, I'm going to have lunch and we're going to try and make it as fun as possible. We're going to do some role playing and talking and just being silly and being fun, but also getting down to the nitty gritty of what we're doing actually really matters for our patients. So I think it's the little things, try to throw in lunch, try to do something fun, We've done where I've, people on Oprah where they, look under their chair and there's a prize.
Oh,
We've
really?
done that under their desk, under their desk where everybody's sitting and under their tables. And I'm like, all right, everybody reach under the table, and they reach under and they pull out
That's
$50
cute.
gift cards. We've done that before. And, so there's things that we can try to make it fun rather than like, okay, I'm at a staff meeting. This doesn't matter. I'm not going to listen.
If I have to hear one more time about how so-and-so is not stocking the drawers correctly, I'm going to lose my mind.
And things like that. We're firm believers. If somebody's not stocking, that's not a staff meeting issue. That's hey, can you just go stock your drawers? Everybody doesn't need to know Katie's not stocking her drawers.
Yes.
Katie needs to know she's not stocking her drawers. So those are not staff meeting issues.
We're notoriously not a very confrontational group of people based off of like, we chose this profession instead of like heart surgery. And so most of us are like non-confrontational. And so they think they lead their meetings thinking, if I just tell everyone they need to stock their drawers, then Katie's going to get it that she needs to stock her drawers. But everyone knows that it's Katie's problem.
Yes.
Just talk to the person. Yeah.
Yes. Yeah. So directing where issues are that need to be directed at just maybe one or two employees. Yeah, that's not a staff meeting issue. These are just general group meeting things that we're going over, and it's not a complaint session. It's usually, it's meant to be as informative as possible, and structured, but relaxed. And like I said, when we do training, we try to make it fun.
Yeah.
It's got to be fun.
That's awesome.
Well, all of these kind of things that you talked about, like show in your data, which is why we're really here. And we want to talk about your data. So I'm going to rattle off some numbers. Just for 2022, your patient acceptance is 81%. Your treatment dollar acceptance. So about all of the treatment that's been presented, the amount of money is 52% collected. Your same day treatment. So any of the treatment that's been either completed that day or booked out in the future is 40%. So those three numbers are kind of like pillar, like case acceptance numbers that we track here at Dental Intel. And all of those numbers are in the top 10% of all of our 10,000 practices that we look at. So really, really big, especially we want to highlight the same day treatment acceptance at 40%. Most practices sit in the 20 to 30-ish%. If you're looking for like a benchmark, if you wonder where you are as an average.
Okay.
And so 40% is really great. And we want to talk a little bit about, and we talked a little bit about how you do that, because you're doing it with Morning Huddle, right? You're looking to see how, who needs that. But talk to me a little bit about how you let's talk about same day acceptance.
Same day conversion. So with same day conversion, the first key to the whole puzzle is you need to have a doctor that wants to do same day. If you have a doctor that doesn't want to convert same day, you're working against yourself to start. The second part is that you need to have your assistant on board, because that requires to be prepared. If you're not prepared, then once again, you're paddling upstream. You get those two things on board to start off with, you're going to be in good shape, because you have a doctor that's already aware and willing to do same day treatment. And then you have an assistant that once again is aware and willing to do same day.
Let's
you
get there for just a second, because that's a
Yes.
huge mental shift. If you've worked in a practice
Absolutely.
and you as a doctor, you might not be one that wants to do same day. It might stress you out too much, I guess. You know what I mean? Like that's not something that I really thought about too much. You know what I mean?
Yeah.
Like it's definitely like, do you want to increase your same day percentage? And if you do, then, and you do as a doctor, then the next step is to get your assistants on board. I just wanted to pause on that real quick, because that's really important.
No worries. So it's kind of a tripod thing, because you got the doctor, you got the assistant, and then you have the patient. Those are the three main parts to, you can't have same day treatment without a patient. So that's the other main portion of those three pillars there. And we live in a world of now. everybody wants everything now. You don't go to Blockbuster anymore and rent a movie. You just go on your TV and you just click a button there, you got it. People don't want to wait. For the most part, you have those patients that are anxious and they will put it off as long as they possibly can. But a general consensus of how we live is a here and now. Hey, you need a crown. Can we do it today? And if that answer is yes, you've already got them. It's not a hard conversion right there, because they've asked, can we do this today? Or we have that conversation of, hey, Katie, you need a crown. Would you like to get that done today? We have time to do it. And this is how much it's going to cost. You give those quick little details of go over cost and time and what to expect. Most of the time, the patient's like, yeah, let's get this done, because they've already taken the time out of their day to get to our office. They don't want to do it again if they don't have to, whether it's taking time off work or having to have somebody watch the kids, or pick the kids up after school and you're rushing to go back and forth, or they're sitting in the lobby fighting each other while you're trying to get treatment, or they're in the room and on an iPad, whatever it may be. All these situations happen. So if you're there and now and you're by yourself and you're ready to go, we need to be there to pull that trigger and say, let's do it. Does it always work? No, because obviously our number's not 100%, but 40% of the time, that's close to half the time of the patients coming in, we're able to give that service. And I feel like that percentage would be even higher if you had the ability to do more. So that's just us utilizing that time that we have. So that might be a hard metric to run, but of those, of the areas that we're able to do it, what that percentage is, I don't know, but I'm sure it's higher than that. Just due to utilizing our same day time, because we don't just sit on a schedule of same day, so it's just maximizing your dollar for dollar per day on those open times of your schedule, that you can be productive.
I love the way that you phrase this for the patient. Actually, Katie and I were having this conversation earlier today.
You took like his words. Yes. It was today.
So I have someone that I've worked with in marketing for a long time, owns a practice, and he mentioned, hey, we're really focusing on same day treatment. We're giving people a 10% discount if they do same day treatment because it means so much to us. And I just said, well, you need to reframe that as we're doing you a favor. You don't have to come in again. We'll get you in right now. If you've got same day time, just tell them we can get you in right now. Don't give them a discount. Just frame it as we can do you a favor. You don't have to find a baby. Like you said, don't have to find a babysitter another time. You don't have to worry about any of those things. We'll just get it taken care of. So yeah, definitely. Absolutely. As you're looking at same day treatment, I mean, for me, for my wife, when we go in, if it can be done same day, it's getting done same day. And so,
especially if it's a toothache, it's things like that. Those are the big things we talk about when we got a patient that's on the schedule for a limited and they're, lower right pain. And we already know that may be an issue of a tooth that we've already treatment planned and it's already been diagnosed. That's where you can be prepared is, hey, doc, they're already coming in lower left. We already know there's an issue there. We already told them they need a root canal. Would you like me to go ahead and set up for that if they're ready to do it? Then we already know then coming in. It's not just because it's same day doesn't mean we're rushing and we're behind the 8 ball. Same day can be prepared. It can be methodical. It can be planned out. It doesn't always have to be, oh, we're doing same day and I've got to rush to set up. You can be prepped. You can be ready. So it's once again brings in touch.
Let's get into that process a little bit, because I think a lot of people hear same day and think like, well,
spontaneous,
just more work.
Yeah. Well, I think you mentioned it like maybe the doctor doesn't like it. It causes more stress. But if you do it the way that you just mentioned, then it's less stress. Like they're prepared for a lot of it already.
So somebody comes in for a toothache. What's the process to get them, like, the assistants prepared so that, like, as soon as the parent signs off on a stainless steel crown or whatever it is that you guys are root canal and crown, what does that process look? And it might seem silly to you to map it out like that, but I know that there are people, because it might just seem like obvious, and it might seem obvious to some of our listeners, but I know that there are some people listening that really want to know, like, what does it look like for you to, like, be ready to, so that when they say yes, you're ready to go.
Yeah. So most of the time we're having these toothaches are limited. So you have a little bit of leeway before these patients are coming in, and it's not always on the peds side. It's actually probably a lot more on the general side.
Oh, okay.
But we get this information, and one of the things we ask is, are you looking to have any work done today? Or we can say, we're squeezing you in. Doctor's going to do as much as they can, but I don't know if we're going to get treatment. We we drive the seat there. That's
So
one
this
of the
happens
biggest
before the patient is even in the office.
even before they're in the
Okay.
office, because what do we have control over? Our schedule. We a lot of times kind of think that the patients drive our schedule, but they don't, because they don't know what openings we have. They're not looking at our computer. So if we look at it and we're methodical about it, we can drive that. So before the patient's there is knowing, is it a true emergency? That's the first thing. And then, checking their chart and their treatment plan. Do they have treatment in that area that's been treatment plan that's not completed? Were they just seen in the office? Those are a lot of those kind of driving questions, because they're all going to tell us a story. It's, oh, Katie was just here. She was here 3 weeks ago. She just had a filling done. She's having sensitivity in her lower left, and that's exactly where we were just working. So maybe she's having an issue with her bite. So we kind of have an idea. Okay, hey doc, she was just in having pain and sensitivity in the lower left. We just worked on it last week. It could be due to something that we're working on there last week. Or we treatment planned a crown. She's hasn't been in pain, but we kind of knew it might flare out because we need to get this done. I'm thinking that's what it is. Do you want me to go ahead and set up for the crown and see if she's ready to do it for same day? And then we can say, hey, we've got the time to get it done today. Would you like to do it? We can either call her or tell her right when she walks in the door, one or the other, depending on that patient. We can it's kind of like your perfect handoff is IDing our patient. Do they need that prep before they come in, knowing what's going on, or are they good with us just saying, hey, on the fly, we're ready to go. Are you? And go with it. So we can kind of drive that. And it's all about asking those questions. We need to really know what truly the problem is. Because if it's really needed to be done same day, one, they're going to be available at the time you need them there. It's not going to be, oh, I can only be there at 8 a.m. If they really want that same day done, they're going to be at the time we have available. If it's not, they're not so much looking forward to it, having it done that day.
Yeah.
Does that make sense?
Yeah. And this is going to get even more granular a little bit, but like clinically, do you guys have your trays already? Like how is it set up? Like, so if I'm going to do a crown, I'm
Yes.
being serious, because some people
absolutely.
like, they want to know these systems. They want to know how do I even do that? So
our doctors all have the same operatory kits. So whether we're doing a filling, we're doing a crown, we're doing, unless it's surgical, we have separate surgical kits and implant. Those are more involved procedures. But if you're doing fillings, crowns, anything in that realm, it's the same operatory kit. So you already have that ready to go on your tray.
So they have the same burrs in all of their blocks. Like everyone's using
same burrs in all their blocks,
things.
same hand pieces all across the board. So the thing is if you have one assistant that likes her room set up this way, and you have one assistant that likes their room set up that way, it doesn't fly. Our rooms and our office are set up almost to the T, exactly the same all the way through. So each drawer contains the same product. So if you're in room 1 and then you have to run to room 3 because doc has same day and but it's not the room you normally work in, you know where everything's at. That's how you work efficiently.
That's a simple concept, but it is
absolutely
huge. A lot of people do not work that way.
No, and you can't work efficiently. It's impossible. I would definitely, if somebody could prove to me that they can work efficiently with rooms set up differently and have different employees going there, I'm game on that. I would love to see how somebody could do that.
And how much easier
it's impossible
for you to, speaking of staffing dilemmas, when you have somebody new come in to train someone on one room setup, as opposed to in room 3, we set it up this way. And room 5, he likes his burr block set up this way,
Yeah. And we're actually going down. So the doctors right now, 2 of our general dentists, they have a little bit separate burr blocks. We're actually going down to, standard burr block across the board. A lot of our materials we use throughout the office are all exactly the same. There's very few materials that maybe only one doctor uses, other than like maybe pediatric specific products that we use. But pretty much across the board, all of our products are the same, which once again gives that same repetition. It's the same stuff. You're not you're not doing this for one and this for another. And there's, there's very, very minimal things that are different.
And it
But
probably cuts down on ordering costs.
oh, absolutely.
Yeah.
Yes.
Yeah.
So I think if we get, like you said, granular, that's the biggest thing right there. Get away from what's in your packs, what you're setting up, or how you do that is set your rooms up the same. It doesn't matter where you're at, where everything is. I think that's essential.
So if they want to do same day sealants or a same day pulpotomy or whatever, it's just all like in the room. Like it takes like seconds to set up.
Yeah. Well,
That's
I mean,
huge.
we did same day sealants from hygiene today. I actually, and I don't assist every day. So you got to think in my aspect, I see that. I'm typically, I'm in my office right now. And then I go into an operatory and, I get pulled and said, hey, we're going to do some sealants. Can you set up? And we were ready to go in less than maybe 3 minutes. I get my etch bond and seal and get everything in the room. Doctor's in, we place the sealants and we're out in 15 minutes. Yeah. And it's quick and easy. It doesn't take a lot of time and it wasn't stressful.
That's one thing I guess I want to point out. If you're struggling with team member struggles and like trying to to deal with your team members to kind of wear multiple hats right now while you guys try to figure out people to fill, is maybe think about this, like think about what you can do to make things more efficient. So your office manager can step in and know right where everything is.
Absolutely.
Yeah. I know that.
And that provides back to team culture is your office manager is a team player too. Whether, I am, I don't work at the front desk. I have my own office, but if I need to answer phones, that's not above me. If I need to take a patient's payment, it's not we're all a team, and that provides right back into that culture. If there is a hole, we all need to see how we can come together and say, how can we fill this hole so the patient doesn't feel the pressure? And I think that's the biggest thing that we always need to have.
And you've created systems so that everybody can step into that person's shoes if they need to. So if a hygienist needs to answer
for the most part, yes.
Well, yes, but I mean, everybody has things they need to work on. There's one for you today, but so the hygienist can, pick up the phone and they know exactly how to answer the phone and how to schedule and yada, yada, or take a payment and the same thing on the other end. So that's not something that we actually think about a lot often when we're talking about a same day. We don't, because we're so business focused that I don't think about like the clinical, like what it would take to get ready to actually do the treatment.
This reminds me of one of my favorite books, The E-Myth, where he talks about letting the systems run the business rather than the people. And you've got it systematized to a point where you can kind of just plug someone in, say, this is how we do it. And granted, there are going to be a little bit of a learning curve no matter what, but you minimize that significantly.
Yeah.
And a lot of it's mental too. Our assistants are used to doing same day treatment and things like that. If you're not mentally prepared, you're already going to be a bit slower because you're taking that step back and you're not used to that bigger picture of one, why we're doing it, or two, it's not always the easiest solution, but it's best for the patient. So having that mental shift of, okay, we're probably going to be doing same day. Let me just have these extra things out. If we don't use it, great, let's clean it and put it back. Yeah. But if you already have it out, it's ready to go. And then it saves you guys a ton of time.
That's a big mental shift for a lot of people. A lot of assistants are not willing to set up, or hygienists set up ahead of time if they, like, why would you do that if you don't know if it'll be used? But in the off chance that it saves a lot of time. That's really great.
Absolutely.
I want to talk about, unless you've got something else on same day, treatment dollar percentage. So this is a really high, I mean, you guys you're getting a lot of treatment accepted. So not only just same day, but like the amount of money that you're getting accepted is really high. So talk to me a little bit. I mean, this is probably a cumulative effect between the back office and the front office, but how do you, didn't we talk about intraoral photos? Was that you and I?
Yeah, we talked about that. Yes.
But like, talk to me a little bit about your guys's, what you think attributes to the fact that you guys have such a high treatment dollar percentage acceptance, treatment dollar acceptance percentage. Sorry, I
It's a
said that
mouthful.
backwards. I know, it really is. I wish someone would rename that in our dashboard.
Yeah. So this is one of our styles of treatment planning and talking to patients about treatment. You can show a patient an X-ray. Sometimes it's very clear, and sometimes if they're not in dentistry, I don't see anything. I just see an X-ray of a tooth. But if I show you a picture and they're like, oh, that's kind of gross. Yeah, that's actually your tooth. And then they see it and they say, oh my goodness, I don't want that in my mouth. I want to get that taken care of. That's one really good tool right there. And it's not to shame the patient, but they may not actually see it, because there's areas of your mouth that you can't see without getting with a camera. So that's one tool that we really use is we utilize our intraoral cameras a lot. And not only is it good for the patient, it's also good reinforcement for our claims for insurance. They want to see proof too that we're doing what we say we're doing and why we're doing it. But if I just tell you, you need a filling, is that just, the joke we always kind of say is, oh, I'm just paying for the doctor's vacation, or, got his new car, there's that stigma with dentistry, and there shouldn't be, because, we're trying to get your mouth up to healthy again, and to where you don't have the cavities and the decay in your mouth. So if we have that proof, it builds trust with the patient, because it's not just, oh, you have a cavity, it's here, I'm showing you what it is in your mouth. And they can see that it's something somewhat tangible, that they know needs to be taken care of. And we have sheets too that just show, hey, I see this crack in your tooth. Now your tooth isn't to this point, but this is where it can get. And we have sample photos of that also. And it's not a scare tactic. It's just, hey, if we take care of it now, it's going to be way easier and way more beneficial for you than getting to this point where treatment's going to be more expensive and more extensive. So let's try and tackle this now. And it also comes into being genuine, being clear. If you're not clear about the treatment and you're not even coming across confident, that's going to bring some resistance to the patient and doubt. And if like, well, yeah, you can do this cavity. No, doctor said this really needs to get done and we need to get you scheduled as soon as possible. That's true, because he did say you need to get that done, and we do need to get it scheduled as soon as possible, because that decay is going to grow. It's going to get worse. It's not going to get better. It doesn't go away. So those are some tools that you can use, and our team uses, is let's get you on the schedule. When would you like to get scheduled? It's not, do you want to do it? It's like, do you want to pay? No, I don't want to. You don't give the patient those options. It's, once again, we're in the driver's seat. It's just like scheduling a patient. They don't know what appointments we have open until we tell them. So let's tell them what they need to get done, and let's drive that seat and say, hey, you need to get this done. When would you like to get scheduled?
Yeah.
Then it's, oh, I need to do this.
Yeah, we talked about this before, and I think it's important to bring up again is like getting over the stigma of selling, in quotes, dentistry, right? Like, talk to us a little bit about that, because I think you had some really great points on that. Like, how do you get over that? How do you get your team to get on board with like being all in to what the doctor diagnoses?
Well, and I think that part just kind of drives into the culture too. Like our assistants that work with each dentist they have this special relationship with the dentist, and they believe in what these dentists are treatment planning and diagnosing in these patients. So it's not like, doc said you need to get this done, but I don't know if I would do that. Like, they have trust because that's their dentist too. And so we're not here to just sell dentistry. I think that's a terrible mindset to have, in a way, because nobody wants to come in and just be sold on one more thing, without really feeling that they're getting that true benefit. So if we're in there and we're explaining to our patients, this is why you need it, because it's best for your health. It's not just, I'm selling you a brand new cavity. We're going to fill this today. Like, we're not selling that. Like, we're telling you, like, listen, we found a problem and this is how we can fix it. We need to get out of that stigma that we're not selling it. The selling is not even convincing the patient, but just it's getting them to realize that it's a problem, that they are not one, whether it's genetics or lack of oral hygiene, there's something that has happened that needs to be fixed. And if it's not fixed now, it's only going to get worse. So it's building that relationship with the patient. And I think that's where the selling in quotations happens, is we're building that trust with the patient and saying, hey, this is where it can lead to. Let's stop it before it gets to that, because that's actually going to cost you way more money. I want to fix it now. This is going to be the most efficient thing for all of us. It's going to be better for you. We're going to be in and out in a quick, easy procedure. If we let it go, this is where you're going to end up, and it's just inevitable, and it's going to be a lot more expensive for you. I'm more likely to go to the first option, because one, what does that tell me? I'm going to spend less money, and I can get it fixed a lot sooner. If I wait, it's probably going to hurt me, and I might not even be able to get in when I want to get in. And they're telling me I can get this done in a week. Let's go ahead and just get it done, taken care of. And then I know, hey, I don't got to deal with that anymore. So there's multi areas.
Yeah, that's a high level of education that you're giving those patients. Do you guys block out time? Like, how do you make sure that much education can get done? Because I think I can hear people saying, well, it's nice for them. They've got 3 hours for a new patient,
No. And we schedule 2 hours for new patients if they're 30 and above. So, that's ample time there. And then after that, when we build that relationship, the conversations are shorter and shorter, because you're not having to do as much. We built that trust with them. So you take that time out of that first appointment and just say, hey, doc really thinks that this is best for you. I think we need to get this on the schedule. Let's get this taken care of. They get it taken care of, and they're like, wow, the next time they come in, they don't have a full mouth of cavities because they've had it taken care of. So now it's smooth sailing, it's maintenance. It's making sure that we don't have any other issues come up. So it's really taking that first appointment. It's worth that sacrifice in schedule time.
Yeah, you're investing 2 hours in that patient. Yeah, that's a big deal.
Yes.
That's a big investment. But so that also means
but the return on that is years of that patient coming back. One, for the routine cleanings, and two, they trust you to do the treatment. So are those 2 hours worth it in the beginning? 100% to me.
Yeah, 100%. I think that's reflected in your treatment acceptance rates. Your top 10% across the board. A couple things that were interesting to me. You mentioned not just, oh yeah, you need a filling, right? How things kind of used to be. That's not the way that they are anymore. If you haven't keyed into the fact that the general population is skeptical towards authority in the last several years, you're not paying attention, right? I'm not making that up, but
no, absolutely.
If you're using X-rays, intraoral photos, a mirror showing them what's going on, all of those things, and then taking the time to build that trust, it's going to go so far in the future in terms of what they're going to be willing to accept, and it's clear. This is to see the numbers this high across all case acceptance numbers is I haven't seen it before. Sometimes someone will have one that's really skewed really high, and they'll be in the top 10% here, but then one is non-existent, right? It's
usually same. Like they usually have a high case, like high patient acceptance, but their same day is really low.
Yeah.
So seeing them all there definitely attributes to how much time you're putting into building that trust and that relationship, and what that creates going forward with the patient. So that's awesome.
Well, thank you. And the last thing too that I think is icing on the cake is as the doctor's coming out of that exam and before he walks out of the room is, we'll see you back for those fillings. And reinforces that treatment before they walk out of the room. So he's diagnosed it, he's talked about it, but then where they're walking, let's get you back on the schedule to get those fillings done. Let's get you back on the schedule to get those crowns done. Let's get you on the schedule to get that night guard done. And it's just that one last little bit of positive reinforcement as they leave. That's the last thing the doctor said to them is, I need to get back here because he said I need to get it done. Because the hygienist can say, yeah, we need to get you in for these crowns. Remember that was treatment plan. And the hygienist can say, hey, that's still in pending treatment. And they leave and they're like, oh, doctor said I got to do it. they're
Yeah.
more likely to
Yeah, sometimes
you know.
we think that and we talk about this a lot in marketing, and we talk about it in the
Mhm.
handoff ebook, but is that we oftentimes think it's redundant to have a patient here that they need a filling from the hygienist or the assistant, the doctor, again, maybe a couple times, and then the treatment coordinator. But to the patient, it's just reinforcing it. They're not hearing it. They don't feel like they're being picked on. It's like every time that they hear, the first time they hear it, they probably don't hear it. And then the second time they go, and then by the third time, they're like making a decision to do it. And in marketing, we use that tactic all the time to help reinforce people to make a decision to choose to buy. And I mean, if you can call it selling, or you can not call it selling, but that's essentially what you're trying to do, is you're trying to get the patient to accept treatment by the end of the time they leave. And if you only bring it up one time in passing, you're going to get a no every time.
Yeah.
That was my soapbox.
Well, I know
Sorry.
Well, you don't go home. If I were to say, hey, Katie, you need a filling, you're not gonna, most people aren't gonna go home and be like, oh, I need to get that done. Like, I need to call my dental office and I need to get this filling scheduled.
Yeah.
Like, no, nobody's gonna do that. Like, not even me. Like, so if we
and the
reinforce
patients
that,
that do, you don't want them anyway, because they might be crazy.
Yeah.
Just kidding.
No, nobody has crazy patients, right?
No, none. There's none. Yeah.
Oh man. But yeah, it's one of those things is like you said, it's reinforcement. It's letting them know also that it's important to us. It's not just that it needs to get done. Like, we truly care. We care about your oral hygiene. We care about your oral health. Like, we want you to come in and be healthy. We'd love to see when our doctor comes in and says, hey, you don't need any treatment. Congratulations, you're doing great.
Yeah.
I mean, that's a great feeling.
Mm-hmm.
And I feel like just getting back on that tail end of selling, like when you're selling something, you're trying to find that emotional connection to something, right? When we have an ad or a commercial, like there's some sort of emotional connection.
Mm-hmm.
Really, the only emotional connection with getting treatment accepted is your health.
Yeah.
And that's an important emotional connection. That's not just a rational decision or irrational decision. It's something that it's vital to your well-being. So I think that's kind of what changes the viewpoint between selling and finding that irrational emotional connection and really getting back down to the true root of what the problem is, and that it's a need. It's not just a want.
Yeah.
Touching on that again, these numbers are not just people saying yes. These numbers are people that have followed through with saying yes. You don't get case acceptance if they didn't actually get the treatment, right?
Agreed.
So
yes.
There's another factor in there with that repetition of when I take one of my kids to their pediatrician, which doesn't happen often. But this is my.
I'm guilty too.
That's part of my point. Not because our kids don't go normally.
I know your wife does everything.
Yeah,
I
she
get
usually
it.
does.
She's the same.
So I'll take one of them because some things happened with the schedule, and I'll come home and they'll have an ear infection or something, and my wife will ask me like 50 questions about it. I'm like, I don't know. Yeah, I don't know any of that. They just said she has an ear infection. She needs amoxicillin. I don't know. But she's got all these questions for me. And that's also going to be the case when you present something to someone. If you've just said it one time, hey, you need a filling, and then they get home and their spouse or their friend is like, well, why do you need a filling? Yeah. And you haven't shown them and you haven't reiterated that multiple times of what it could turn into, or that multiple people have told them that they need it. Yeah. It's something that you could definitely talk yourself out of, because at the end of my conversation with my wife, even though my daughter's been crying about her ear for multiple days, I'm like, well, does she really have an ear infection? I don't know.
I don't know. Most people don't even remember the tooth that you would diagnose the treatment on, especially if it doesn't hurt. You know what I mean? Like, how are they going to remember what they need? They can't even remember where it is in their mouth. Yeah. Yeah. Yeah.
So.
Oh, yeah. So good. There's so much to learn here and unpack. An hour went by so fast for me.
Yeah. This was huge value.
Yeah.
Like each piece of this, you could take and extrapolate and implement in your practice and see gains across the board.
Yeah.
So.
Yeah. Well, we might have to, they're exceptionally good at collections percentage too. And I don't want to skip that, but we're going to have to, because really we're running out of time, but we'll have them on again. But honestly, there's so much to learn from Satellite Dentistry. And also if you would like to work by Cocoa Beach, I'm sure they love.
Katie's recruiting for you now.
This is also, I'm going to help everyone's staffing dilemma that comes on this podcast. What are you looking for anybody? How can we help you? Yeah. But anyway, we asked the same question to every one of our guests, and that is, what does growth in dentistry mean to you? And it might seem, and we probably have already talked about it. We've had an hour here to talk about it, but you mean, with your experience as a lab tech and your experience as an office manager and everything that you've shared with us today, what does growth, I guess, at Satellite Dentistry mean to you? Like, what does that mean? What does it look like to grow there?
Well, we're right in it right now. I mean, we're in a pinnacle point of, we've just added 2 more providers, and we're equipping the last few rooms that we have available in our practice. And that one is a tangible growth right there. But also just seeing our team grow, not only as more team members, but in their skills, and learning new things, and growing as a team of adapting to the perfect patient handoff that we're trying to do, and just getting more tight knit. And that's really where I see a lot of what I see as growth is our team, bringing those new patients in and getting better and better at building those relationships and adapting to our challenges, and kind of holding each other through those situations.
Yeah, that's really great. Well, it's been a blast. Thank you so much, Zach, for joining us.
Thanks for having me.
Any of you I'll skip it, whatever. I'm rambling at this point. And I'm not going to cut it out. You just have to deal with it. This has been Growth in Dentistry, a dental intelligence podcast. Again, special thanks to Zach Shelley of Satellite Dentistry for joining us. You can find links to our let's see, what do we have in our show notes? We're going to have our demo request for $50 off to complete a demo for dental intelligence. And what else? I think that's all we need to put on our show notes today. So thank you for our marketing on this marketing department on this podcast as well. I'm Katie Polson, and this is Adam Smith. Say goodbye.
Bye, everyone.
Keep growing.